Thank you for choosing Sharp Home Infusion Services for your home IV therapy needs. This is part of a series of short videos on how to safely administer your IV therapy at home. This video covers the steps you will take to administer your home IV therapy. You should have already washed your hands and prepared your work area as described in video 1. Here are the supplies you will need: an IV medication bag, IV tubing, several alcohol wipes, 2 saline flush pre-filled syringes, 1 heparin flush pre-filled syringe, only if your doctor ordered it, 1 sterile tubing cap, if you will be reusing the tubing within 24 hours, an IV pole, and finally, hand sanitizer. To help the process go smoothly, arrange the supplies in the order you will be using them. If your medication is not pre-mixed, be sure to watch either video 2, How to Prepare Medication with the Mini Bag Plus, or video 3, How to Prepare Medication with Valmate. If your medication is stored in your refrigerator, remove it 30 minutes before your therapy session to bring it to room temperature. It's safe to use cold medication, but it can feel a little uncomfortable. Before you begin, check the medication label. It should show your name, the correct drug, and the proper dose. Look at the expiration date on the label to make sure your medication is safe to use. Also, check the bag to make sure it isn't damaged or defective. If you have any issues or questions, please call your nursing agency or pharmacist before proceeding. With your medication mixed and ready, remove the tubing from its packaging. Turn the tubing dial to the off position. Remove the cover from the IV bag. Remove the cover from the tubing spike. Be careful not to touch the open ends to any unsterile areas. Spike the new IV bag with the tubing spike by simultaneously pushing and twisting the spike into the bag. Do this until you reach the ridge of the spike or close to it. Squeeze the drip chamber on the tubing to fill half of the chamber with fluid. Turn the tubing dial to the open position and clear the IV tubing of any air by allowing the solution to run through the tubing. To avoid the risk of contamination, do not remove cap on end of tubing while priming tubing. Once the tubing is clear of air, quickly turn the dial to the off position to keep from losing any of the medication. Using one of your alcohol wipes, scrub the top of the injection valve on the end of your vascular access device for 15 seconds. Remove the cap from 1 pre-filled saline syringe, expel the air, and attach the syringe to the injection valve on the catheter by turning the syringe clockwise into the valve. You will need to keep tip of the syringe pushed into the valve while turning the syringe clockwise. Note, be very careful to avoid twisting off the valve while you attach and detach the tubing or syringes. Now open the catheter clamps and inject 10 milliliters of saline into the catheter using the post-flush technique. This means you advance the syringe plunger forward with small pushes of about 2 to 3 milliliters of saline at a time, pausing between each push until the syringe is almost empty. Disconnect the syringe from the injection valve. Scrub the injection valve with another alcohol wipe for 15 seconds. Remove the cover from the end of the primed IV tubing and attach the IV tubing to the injection valve on the catheter. This is also done by simultaneously pushing and turning the tip of the tubing clockwise into the valve. Turn the tubing dial to the number directed by your nurse. Be sure to administer each infusion for the total time directed by your nurse or pharmacist. Setting a timer is helpful. Once your infusion bag is empty, turn the dial to the off position. Your infusion bag is empty when it is no longer dripping into the drip chamber and the bag is empty. There will still be fluid in the drip chamber. And remove the IV tubing from the injection valve on the catheter. Please note, if your tubing is going to be reused within 24 hours, be sure to cover the end of the IV tubing with a new sterile cap. Scrub the injection valve on the end of the catheter with an alcohol wipe for 15 seconds. Remove the cap from the remaining pre-filled saline syringe. Expel air and attach the syringe to the injection valve. Inject 10 milliliters of saline using the post-flush technique. Disconnect the syringe from the valve. If your IV catheter requires the use of a heparin flush, scrub the injection valve with an alcohol wipe for 15 seconds. Then remove the cap from the pre-filled heparin syringe. Let out air from the syringe and attach the syringe to the injection valve. Inject heparin into the catheter using the post-flush technique. Disconnect the syringe from the injection valve. Close the catheter clamp, making sure that the injection valve remains on the catheter. If your IV won't start, make sure all the clamps on the tubing and vascular access device are open and that the tubing dial is set at the correct rate. Make sure the IV pole is at its highest setting. You can also try pinching the tubing and checking to make sure there are no catheter or tubing kinks. Your infusion should start within seconds. If you have any questions or concerns, please contact your nursing agency. Thank you again for choosing Sharp Home Infusion Services.